Hi, this is Glenn Macnow, and I'm here with Dr. Jeffrey Tomaszewski with the MD Anderson Cancer Center here at Cooper Urologic Cancer Program. Now, Doc, in light of Pennsylvania Governor Tom Wolf's announcement a couple weeks ago that he has prostate cancer, we wanted to sit down and talk with you about prostate cancer, about causes of it, about treatment of it, and really, it's something that a lot of men worry about and a lot of men go through, and so thanks for joining us.
Thanks for having me.
That's a pleasure. So let's just start with the basic of what is prostate cancer.
Sure. So prostate cancer is actually the second leading common cause of cancer among American men, next to skin cancer. So, and the prostate's an organ that sits down in the pelvis. It sits in front of the bladder, and basically the prostate helps make things to liquefy men's semen. Okay, so it doesn't serve much other function than that, but unfortunately for many men, with time the prostate can go through cancerous changes and it can develop dangerous cancerous changes within the prostate. So that's a broad overview of prostate cancer.
All right, what are the causes of prostate cancer?
So there is no single cause of prostate cancer. It's really multifactorial, meaning a lot of different things can cause prostate cancer, whether it's a family history, which is important. Some studies believe there are some genetic linkages to prostate cancer, but there's no direct inheritance pattern. So if your father had it, you won't necessarily have it, but you are at an increased risk. And certainly the way we live our lives can impact your risk of prostate cancer. Diet, exercise, smoking, all those things can increase the risk of prostate cancer.
We're going to get specifically into some of those areas that Dr. Tomaszewski brings up, but let's kind of go general. We'll bring it in, rein it in a little more. How is it diagnosed?
So most of the time, prostate cancer is diagnosed incidentally, meaning from screening. Okay, so most men won't have symptoms from their prostate cancer until it's too late. Symptoms men will have can include changes in your urination, blood in the urine, difficulty passing your urine, burning when you pee, pain, unexplained weight loss. Those things can be how it presents in late stages. But for most men, we find it before they ever have symptoms by screening.
Okay, and that's really the key with this. I've always heard this. Let's talk about screening. The simplest question is, if you're a man, when do you start?
Right, so lots of controversy about screening, and you've heard a lot about PSA in the news, but we'll go over some of it. But basically, if you're a man between the ages of 55 or 54 to 69, you should be screened for prostate cancer after you discuss it with your doctor and consider the risks and benefits. So if you're over basically 55 and to 70, you should be screened. If you have a family history, a first-degree relative with prostate cancer, or you're African American, you should be screened earlier, as early as 40. Okay.
It's an interesting. Let's just want to stop you for a second because that's an interesting aspect and somewhat surprising. African American, you're more prone to it?
Absolutely. That's one of the risk factors we didn't talk about. But African American men have a much higher natural incidence of prostate cancer. So very important for anybody listening who's African American to realize that. And you're at an increased risk, so you should definitely talk about screening with your physician.
Okay, so you said age 55 to age 69. How often?
So that's controversial. The American Urologic Association basically recommends screening every other year. And the reason to do that is because there's a lot of downsides of screening, right? We're trying to detect a cancer that may or may not affect your lifespan, okay? So if we overscreen, there are some treatments and harms from overdetecting prostate cancer. So by spreading out the screening to every other year, which is a new recommendation within the last couple of years, we can sort of minimize some of those deleterious effects of screening.
All these years I've been doing it every year.
Yeah.
All right. You said it's 50.
And it's an easy sell for guys, right? Because it includes a rectal exam.
It is not.
And a blood test. So.
It is not. And listen, I'm sure you know that there are millions of men who just say, I really don't want to do that.
Right.
Right?
Every one of them, when they come into my office, says
right.
that. I don't want this exam today. But
right.
You've had it done, and everybody else who's had it done can tell you it's really not that bad.
It's quick.
Yeah.
You think about other things. You think about baseball in your mind. You just get something else going, and then it's over, and then there you go. You go home. Okay, after age 69?
After age 69, so 70 and up, basically, we don't recommend routine screening for prostate cancer. Now, take into account that not all 70-year-olds are created equal. So if you're, have the longevity of maybe a 50-year-old, or you're very active and healthy, you may have a long enough time to live that prostate cancer could impact your survival. So we do recommend, in select cases, consideration of screening for men over 70, but certainly discuss it with your physician first.
Okay. You're a specialist. Do I come to you to get screened? Is this something I can do my annual physical with my doctor?
Right, you can do either. Most men, though, make their way to prostate cancer screening by talking to their primary care doctor first about the risks and benefits of screening, and then get tested and screened. And usually when there's something abnormal, then they come to see me.
Okay. Dr. Tomaszewski, let's talk about the genetic aspects of this. My dad had prostate cancer. He had it 15 years ago. He had surgery. It was successful. My dad's doing great.
That's great.
At 85, he's pretty vibrant. But what is the factor of genetics in this?
Yeah, so definitely a factor. And this is not a gene where there's 100% penetrance, meaning if there's a gene that's turned on or off, there's prostate cancer and he passes it on to you and to your children. So it's a little bit more complex than that. And basically, all we know is that when a family member has it, like your father, you inherit some characteristics in different genes that put you at a slightly higher risk than other people walking around in the street who don't have that family history.
Mm-hmm. Does that mean you should get more frequent checkups or start earlier? Should it change anything that you do?
It should not. It doesn't change your screening for most men, unless, like we talked about, with that family history, start earlier, right?
Mm-hmm.
So, along with African Americans, men with family history like you, I would have started screening when you're 40.
Okay.
And that part of it changes, but there's no other additional testing or no increased frequency of testing because of your family history.
True story. When I was turned 40, my wife said, "I have a birthday surprise for you." Didn't tell me what it was and drove me to the hospital, which was doing free screenings that day, and that was my 40th birthday. So.
Was a urologist?
But she was looking out for me.
Yeah, well, I'm on the other side of that birthday surprise half the time, so
Mm-hmm.
you're not the only one in that boat.
There you go.
But that's a great example for people to hear.
Yep. I
coming
did not
from you.
particularly enjoy it as we got out of the car or the process, but afterward I was kind of thankful, and so there you go. All right, so if someone is diagnosed with prostate cancer, obviously the treatment, I'm assuming, depends on the severity, the level to which you have it, but let's start to talk about that. What's the range we're talking about with treatment?
Sure. The one thing I wanted to touch on too, we didn't get into, I just want to let people know that in addition to PSA, because there has been so much controversy, there are all these new tests we have, genomic tests and genetic tests that can help sort of risk stratify men more than the PSA can. So if you're in a situation where you've had a PSA, it's elevated, and they're not finding something and you have questions, go see a urologist or urologic oncologist like me, because we have all new kinds of genomic and genetic testing we can do to further risk stratify your risk of cancer, the type of cancer, the aggression of the cancer. So really, PSA, in the last decade, we've made sort of leaps and bounds and new discoveries for diagnosing
Great.
it. So that being said, on to treatment. So very broadly, the treatment is very dependent on the grade, your Gleason grade, the stage of disease, meaning how far spread it is either within the prostate or throughout your body, your PSA level, and your overall functional status, right? Are you 80 and you can't get out of bed every day, or are you 50 and very active? The treatment options range from active surveillance, where we're actively watching you with repeat biopsies to make sure it doesn't progress and then we treat you, or treatment with surgery, which is removal of the prostate, or radiation, where we're radiating the prostate.
Okay. Treatment has changed, correct?
It has.
Or thoughts toward it in the last 10, 15 years? Because I
has.
know, again, from when my dad had it, and more recently a neighbor of mine went through it, and I think with the neighbor, it seemed to be a much more conservative approach. Again, I don't know the specifics, but
Yes.
it seemed as if there is less, correct me if I'm wrong, slower to get into the immediate surgery, true?
Absolutely. 15 years ago, almost every man with prostate cancer was treated without much thought. That's changed completely. And now we try and treat only those men we really think are going to have a significant benefit. And if you have a more intermediate or high-risk prostate cancer, you may benefit more from treatment, whereas men with low-risk prostate cancers can be safely watched for many years, and sometimes the remainder of their life without needing treatment, if you're watched closely. Okay, and the reason we do that is because there are side effects of all the treatments, and so to prevent those side effects for patients, we delay treatment as long as we safely can.
All right, Dr. Tomaszewski, that's what every man worries about, is those side effects.
Yes.
And some of them are exactly what no man wants to hear, so let's talk about
Right.
that. One of the side effects is sexual dysfunction.
Absolutely.
I don't know how I can ask you even to address it, but it's just something that men should be aware of. Is it something that's less common than it used to be?
I will tell you that with the refinements of our treatments, both radiation and surgery has gotten much better than it used to be. So overall, our functional outcomes after treatment are much better than they used to be, which is good for men being treated. The side effects we're talking about, of course, mainly is impotence and erectile dysfunction, right? So after any kind of treatment, whether it's surgery or radiation, it can hurt some of the nerves that provide erections, okay? The good news is, it doesn't mean that if you have prostate cancer and are treated, you will never have erections again. It means that we may have to work harder with other therapies, pills, injections, what have you, to get you where you need to be. But I will tell you that almost all of our men who are survivors of prostate cancer still function very well sexually. It's just a matter of needing more effort to get there.
Okay. Other side effects men should be aware of?
Yes, the biggest one with surgery is urinary incontinence or leakage of urine. That's when you cough, laugh, sneeze, you can dribble. Again, that's much better than it used to be, and most of our men, after a certain time point after surgery, do much better. Radiation also has similar side effects with bothersome urinary and bowel symptoms. Again, our radiation treatments have gotten better and more selective, can minimize some of those side effects. So it's a very hard topic to cover broadly, but the good news is there's hope if you have prostate cancer and you're being treated that you can survive with minimal side effects.
All right. Now let's close with this because different cancers obviously have different levels of virulence. Prostate cancer today, either what it used to be or just kind of in general, chances of being cured.
Chances being cured are very good, especially when diagnosed early. The chances for cure are excellent. So that sort of highlights the importance of screening. And really, you need to be checked, discuss screening with your doctor, your primary, or whomever, and get checked. Because if we find it early, it's almost always treatable and often curable.
I did it from age 40 on. You can do it. It's not that bad. That wraps it up. To see this webisode and others, go to cbsphilly.com/CooperDocs.